So one of the most common forms of ozone therapy is actually IV ozone therapy. In fact, it's probably the most researched that's out there. Talking to patients specifically and utilizing IV ozone therapy, why would I do this in my clinic for a patient maybe such as you? It really depends on what the patient is looking for. What are they actually coming in for? You know, some people are coming in because they want to just have more energy, more vitality. Some people are coming in because they have a chronic condition. It could be an autoimmune type condition. It could be Lyme disease. You know, there's a wide range. Even IV ozone therapy for athletic enhancement. I mean, as a patient, everybody has their own need. So, you know, when coming into a clinic and seeking IV ozone therapy, which should only be done by a trained professional, medical professional that understands the benefits of it, which can be vast. We talk about the four main things of ozone therapy and what it does. It mitigates oxidative stress, meaning that bombardment that is actually happening to your body on a regular basis due to different toxins and things like that, it's going to help to balance that out. It's going to increase immune system function. It's going to actually help to increase oxygen utilization, which helps with recovery and overall energy. ATP, so your Krebs cycle, which is what creates energy within your body, it utilizes oxygen to create energy. So we need to increase that effectiveness because as we age, we have less. And then, you know, the immune regulation, which we already discussed, you know, if people are dealing with chronic infections, even just the cold or the common flu, going to your practitioner, utilize IV ozone therapy is highly beneficial. I think that because it is the most effective and it has the strongest systemic effect, using it even on a preventative measure, you know, maybe once a month, is what we did for most of the patients within my clinic. Found the greatest benefit doing that. And so IV ozone therapy as compared to rectal ozone therapy, the main difference is with IV ozone therapy, they're actually drawing the blood, they're pulling that out, they're putting it in the bag and they're reinfusing it. With rectal, you know, just using a rectal ozone bag with a catheter that's obviously going directly in to the rectal cavity. So, you know, they're both very systemic. So going into the blood, we know that the heart's going to pump that around and it's going to have that systemic effect. Through the gut, it's actually going to go through the hepatic portal vein up to the liver, knowing that it also then has a systemic effect. So they're very similar in the sense of having that systemic effect. It really is going to determine what your provider needs, or if you don't have a provider in your area, then using a home unit. And again, if you're going to be using rectal IV ozone, you're going to need to get yourself a generator, oxygen tank. Those things are very easy to acquire, and then make sure that you have the proper equipment, the ozone bag, and that catheter to utilize it at home.